very happy for your recovery. Been like extremely superhero patient. Left the hospital after 90 minutes, which was a record time for us. Patient today had pain in his lower back and right leg for almost 3 years now. Lately, over the last 6 months, the pain has become so severe to the point where he could not really run or do any significant sport activity. On the MRI scan, as you can see on that level here, L3-4, there is a big synovial cyst pushing on the nerve, causing significant narrowing, and also he has some facet joint effusion. What we are going to do today is go into interlaminar approach, remove the ligamentum flavum, excise the cyst, release the nerve, and that should handle the symptoms. On the lateral view here, you can see that he has also significant lateral stenosis on the L3-4 level compared with the level below and level above. So hopefully excising that cyst and do a decompression with the scope will relieve this problem permanently. Good morning, Sean.
Morning.
Now today we are going to do an operation on your L3-4 on the right side.
Yes.
It is endoscopic discectomy or decompression. We're going to put a scope which is about 4.5 millimeter inside the small wound, just like a fingertip, and putting it there with the camera. We're going to clear all the tissue which is pressing the nerve. In your case, there is a synovial cyst, particularly there, pushing on directly on the nerve and causing you leg pain.
Yeah.
Okay. Now, risk of complication is very minimal. You're talking about 1% or less. The chance of not being able to do it with endoscopy is also very slim, but I'm sure we will beat all the consequences on that.
Yeah.
And we expect you to be up and walking probably a few hours post-surgery and go home on the same day. In terms of injuring the nerve or causing any other complication, I have to mention it to you, although it is very extremely super far risk of complication. So we don't need to think about it, but I have to just mention it to you as a possibility. Okay? Any particular question?
What's the outcome if you damage the nerve?
Well, I'm not going to damage the nerve significantly. The worst case scenario, it could be like irritated, having residual leg pain and so on. Okay? But definitely we take care of that 100%, not to touch it in a bad way, let's say. Okay? That's fine. Great.
Thank you.
Okay, so here we need your signature.
Okay.
That's it, as you are signing.
Okay.
Good, thank you. Okay, Sean, can you please tell us about your problem? When did it start and how was it affecting you?
Yes, for the last few years, I've been struggling with my back a few months of every year, but not as bad as last year. But I do quite a bit of running, I do CrossFit, then I find that I can go a few months, no problems at all, and then I have 4 to maybe 8 weeks where I can't do anything at all. And in December last year, the problem became so severe that I actually wasn't able to do anything at all. I was laying on the floor. And usual, take some painkillers and everything will be okay. And we've got to the point now where I can't do anything at all. So I'm hoping that the operation goes very, very well and it removes the issue with the nerves of my spine.
And can you please tell us, how did you hear about us?
I typed into the internet, best neurosurgeon in Dubai, and your name came up on the top of that list. I then went to your webpage, had a looked at some of the videos, and this is how we met. So I got there. So I'm hoping that I get obviously full mobility back with no pain. So I'm looking to get back where I was a few years ago, where I can run, train, not have problems with the lower back, because it's become extremely debilitating at the moment.
Let's be helpful and we'll take it from there, all right?
Thank you very much. No pain. So after I had the operation, I thought I'd have felt a lot of local pain. I didn't feel any local pain at all. The general anesthetic had worn off pretty well, and I left. I was very, very surprised. I was surprised how fast I've recovered. The pain from the backs of my legs and the mobility issues has definitely improved. A lot, not just a little bit, a hell of a lot. So the nerve pains down the back of my leg has gone totally. I still have a bit of movement issues, but I think that's from having the problem for quite a while and not addressing it. And yes, I recovered, I think a lot quicker than I thought it was going to take, which is good. But I do feel a lot better. Yeah, it's slightly more than my expectations, because I thought I was going to be immobile for quite a while. I thought I was going to struggle with moving around. I thought I'd have to stay laying down, it was very, very different than what I thought it was going to be. I'd say if you had the same problem as me, if you've got a pinched nerve or you've got an issue with your back and you can do the same type of operation, it is definitely more efficient than I suppose a normal operation. I wouldn't know the difference, to be quite honest with you. That's worked very, very well, so I'm happy. A very, very big thank you to everyone here and Dr. Rami. I've been impressed with the service and I'm made to feel very, very welcome. And I would come back 100%. Thank you.